Hi everyone, welcome back to the channel. Today I will be talking about something serious but incredibly important to understand: the cancer. We all hear the term cancer all the time. We all know someone who has been affected by cancer. But how much do we really know? What is cancer? How cancer is formed? Why some people are affected and some don't? What science tells us in terms of treatment? If you are here because you are curious, or you want to understand, or you want to know what your loved one might be going through, I will be breaking down each of these topics in simple and plain language. Cancer isn't just one disease. It's actually a group of over 100 different diseases that all have one thing in common: abnormal, uncontrolled cell growth. Our bodies are made of trillions of cells, and these cells follow a strict set of rules. They grow, divide, do their job, and when they are old or damaged, they are programmed to die. The process is called apoptosis, a kind of built-in self-destruction button for the greater good of your body. But in cancer, something goes wrong in that system. A cell gets damaged, often at a level of DNA, the genetic instruction manual inside the cell. This damage or mutation tells the cell to keep growing when it shouldn't. Over time, it creates more and more abnormal cells, forming a mass known as a tumor. So the fundamental problem in cancer is this: cells grow and divide when they shouldn't, and they don't die when they are supposed to. Now, not all abnormal growth are cancer. That brings us to tumors. A tumor is simply a lump or mass of tissue made up of these out of control cells. But here is the key point: tumor can be benign or malignant. A benign tumor is usually harmless. It stays in one place, doesn't invade other tissue, and typically grows slowly. It might still need to be removed, especially if it is pressing on an organ. But it's not cancer. A malignant tumor is dangerous. It invades nearby tissue, damages it, and it can even spread to the other parts of the body. That's make it cancerous. The ability to invade and spread is what separates cancer cells from other less harmful conditions, and this spreading process has a name: metastasis. We will talk more about that in a moment. So how does a normal cell become a cancer cell? It usually starts with DNA damage. This can happen because of environmental factors like exposure to tobacco smoke, UV radiation from the sun, and harmful chemicals. Infection like the human papilloma virus, hepatitis B, C, or H. pylori bacteria. Lifestyle factors such as poor diet, obesity, lack of exercise, or excessive alcohol. Inherited mutation passed down from your parents. When DNA is damaged, the cell might misread instructions. Normally, your body has a repair system that fixes these mistakes. But if the damage is severe, or if the repair system is faulty, the mutation can accumulate, and this is when cells starts to grow in an uncontrolled manner. And cancer cells don't just grow, they also avoid death signal, trick the body into giving them nutrients, evade the immune system, recruit blood vessels to feed themselves, the process known as angiogenesis. This makes them incredibly hard to stop once they have gotten going. Because all cells have DNA and all cells divide, cancer can happen in almost any part of the body. Some of the most common types include breast cancer, often begin in milk duct or glands; lung cancer, often caused by smoking or air pollution; prostate cancer, common in older men; colorectal cancer starts in colon or rectum; skin cancer, often caused by UV radiation, especially melanoma; leukemia, cancer of blood-forming tissues. Each type of cancer behaves differently. Some grow quickly, others grow slowly, some respond well to the treatment, others are resistant. That's why treatment must be tailored to each type and often each person. Cancer often starts silently. Early on, there may be no symptoms at all, but as it grows, it can cause problem. Here are some general warning signs: a lump or thickening under the skin, unexplained weight loss, fatigue that doesn't go away, skin changes or unusual moles, a persistent cough, trouble swallowing, changes in bowel or bladder habits, bleeding for no reason. Of course, many of these symptoms can be caused by other things, but if something feels off, it's best to get it checked. Diagnosing cancer usually starts with physical exam and a conversation with the doctor. If cancer is suspected, doctor might order imaging test, X-rays, CT scan, MRIs, PET scan, blood test looking for tumor markers or abnormal cell, biopsies, removing a small piece of tissue to look under the microscope. Once cancer is confirmed, the next step is staging. That means finding out how big the tumor is, whether it has spread to the nearby tissue, whether it has spread to the other parts of the body. The stage range from 0 to 4, with 4 being the most advanced. This helps doctor decide the best course of treatment. Now the good news is we have many tools to fight cancer. Treatment depend on the type, stage, and patient's overall health. Common options include surgery to physically remove the tumor, chemotherapy, drug that kill fast-growing cells, including cancer, radiation therapy, high-energy rays that destroy cancer cell, immunotherapy, boost the immune system to recognize and destroy cancer, targeted therapy, attack specific mutations in cancer cell, hormone therapy, blocks hormone that certain cancer depend on, stem cell or bone marrow transplant, especially for leukemia. Each comes with its own side effect and risk, and the treatment are often combined for better results. The key is personalized care. Modern medicine tailors treatment based on genetics, tumor type, and patient need. You can't guarantee you will never get a cancer, but you can definitely lower your risk. And here is how. Don't smoke, limit alcohol, eat more fruits, vegetable, and whole grain, exercise regularly, maintain a healthy weight, use sunscreen and avoid tanning beds, get vaccinated, especially for HPV and hepatitis B, go for regular checkup and screening like mammograms, colonoscopy, or skin exams. Early detection saves life. Many cancer, when caught early, can be cured completely. Getting diagnosed with cancer is terrifying. There is no sugarcoating it. But more people are surviving cancer today than ever before. Survivorship brings its own challenges, emotionally, physically, and socially. Many people deal with fatigue, anxiety, depression, or fear of reoccurrence. That's okay, that's normal. Support groups, therapy, and staying connected with friends and family can make a huge difference. You're not alone. Cancer is complex. It's not one disease. It's hundreds. It's not caused by one thing, and there is no single cure. But we understand it more today than ever before. We are diagnosing it earlier, we are treating it better, and we are giving people longer and healthier life. If there is one thing to take away from this video, it is this. Knowledge is power. The more we understand cancer, the better we can fight it, and the better we can support those facing it. Thanks for watching. If you find this content helpful, please give a thumbs up and subscribe for more exciting science update. See you next time.